Hi, I'm Aubrey Adams, and I'm here with Dr. Christy Brown. And we were just talking about the effects of marijuana, how it's affected our family. And you wanted to share about what happened with your son. And what was the comment you were just making to me about addiction?
Well, I think that a lot of people think that marijuana is not a very serious addiction because it doesn't cause overdose death. And so they downplay all of the risks of marijuana because of this one fact. And I think that they have a misconception about the, debilitation of marijuana addiction, especially on younger people. And marijuana is the first drug that people use when they're teenagers, and the younger they use it, the more likely they are to get addicted to it. And so, a lot of parents don't even know their kids are using marijuana, and then they find out that they've been using it for a couple of years by the time they actually find out, because the kids are really good at hiding it. They know their parents don't want them to use it. So anyway, that's what happened to my son. And I wanted to say that marijuana addiction is really, really devastating on teenagers, and the younger they are, the more devastating it is, because it just stops their development. And they need to do a lot of development when they're teenagers, and marijuana becomes their focus in life. And, just taking this drug when they're that young and how it affects their brain, then they tend to give up all their other activities. So they give up, being interested in school, they give up being interested in sports. They just focus on marijuana. My son became really obsessed with marijuana. And my husband and I, once we found out about it, we tried to get him into treatment. We tried to get him counseling. We told him we didn't, approve of and we didn't allow use of marijuana in our house. And that caused him to have a huge rebellion because he was addicted to it and he felt that he needed it. And he was using it multiple times a day. He was really, really strongly addicted. And so he started wanting to grow it in our house. He wanted to write about it if he had an assignment. When I would pick him up from school, I would say, well, what did you do in school? And he would say, well, he couldn't remember. And I thought he was joking with me, because how could he not remember what had happened an hour ago? And then later on, I found out, because I didn't really know this, that he was actually using it before he went to his classes. And as a teacher, I was totally outraged that my son would be sitting in a classroom stoned and just sitting in the back of the classroom and not really, absorbing what was going on. So he found little workarounds, like he would call his friend and find out what the assignment was, because he didn't even know what the assignment was. And so the addiction started to affect his sports. He had to quit soccer because he was just running around, without really focusing on what he was doing. And he used to skateboard. He had skateboarding accidents. So he was able, he had to sit out the tennis season. And he had to do tennis because it was part of his requirement. But he just, started out as a really promising player. And by the time of his senior year, he had been going backward in it. So everything that, teenagers are supposed to do and learn, he wasn't doing and learning. So when he got to college, he was able to get into college because I was really holding, his curfews over his head. And, he got in by 11th grade, but then in 12th grade, he really started slacking off and missing his classes and almost didn't get to go to college because he had failed calculus. But he still was able to go, and we told him, you need to get a B average if you want us to pay for it. And he started out okay, and he, tried his first quarter, and he was able to get a B average, and he could have done much better, but he, just managed to get that B average. But then he got a, C average the next quarter, and then he failed the final quarter of his first year. So he was in really bad situation. He was still, okay in the university, but his grades were plummeting. And he started hanging around a marijuana dispensary. And then he started doing other drugs. And we thought we'd give him one more chance, and we said, well, if you take a class in summer school and get an A, you can go back to school. Did that, but by the next year and sophomore, he just couldn't handle it anymore. He wasn't going to class. Hash oil for this guy, and he was selling drugs to make money to get drugs because he didn't get enough money from us to sell drugs. So we were sending a person to school, paying about $40,000 a year to be a drug addict, and we eventually had to tell him to withdraw from school to protect his enrollment because he had failed all his midterms. And he was very despondent because he was very invested in being at the university, but he didn't want to put in the work, or he couldn't put in the work because of his addiction. So he got very anxious and despondent and started using more drugs to cover up the anxiety that he had. And he wouldn't come home. We told him, you can come home, you can stop using drugs, you can go to a community college, you can fix this. But he refused to come home, and he said, I'm doing great, I'm doing great. And you could kind of see he was ramping up into an almost manic state where he was euphoric, he was happy, but he really wasn't appreciating the difficult situation he was in. And so we weren't giving him any more money. We were telling him he had to come home. We left him at school, and then I got a call from my office at the college where I taught, and the UC health service was saying, has your son had a history of psychosis? And I said, what? And they said, well, he's acting very psychotically, and we're going to send him to this behavioral health facility. So I was just, it was very distressing. So we went down, they put him in this facility. He tested positive for marijuana and opiates. And he was in that facility. I was able to extend it a couple of days. He was saying things like, I have a laser that I can, go through the wall and escape. And that was kind of, his deluded thinking at the time. So they gave him these antipsychotic drugs. They sent him out of the place. I was thinking they diagnosed him as having substance abuse disorder and bipolar disorder. And I was thinking, he's had a psychotic break, he's mentally ill. This is, we have no history of this, but he's going to be mentally ill. So my whole frame of thinking switched from, well, I want my son to be successful academically and want him to stop using it as you now. And it was really devastating. And he had, even though they gave him these drugs, he would stop using them because they have really bad side effects. So he would be manic. He never slept for 3 months. He was, irritable. He was had delusions of grandeur. He would say, "Oh, I saw God." He was drawing pictures. He had never done that before. That's a symptom of mania. And then he was intermittently psychotic. So he decided he wasn't going to use the drug the psychiatrist gave him, and he was going to use medical marijuana. So at 18 in California, you're able to get a medical marijuana card without your parents' permission for any reason whatsoever. And a lot of people were using marijuana to self-medicate bipolar disorder. So he thought he would do that. So he started using marijuana, and I noticed, because we had never, allowed him to use it, but, we thought, well, we can't say no because he'll run away from home. And we wanted to keep him at home because we were worried about, that he might become violent, or, we didn't know what he would do. And he was already getting in trouble with some legal issues, getting arrested for drug possession, things like that. And so we were trying to keep him at home, so we were watching him, and we watched him use this medical marijuana several times a day. He was constantly using it, and he was incoherent, hard to talk to. And then one time he went back to the university, and he lost his cell phone. He was homeless because he couldn't go back to his apartment because he didn't pay the rent. So he was gone. We didn't know where he was. So I was frantic. I called a social worker. She actually found him on the beach with a bunch of other homeless people. And she reported back to me, And so on Easter Sunday, my husband and I went down to the university. We located him. And he was somewhat coherent. And we said, you need to come home. You can't just be sitting here homeless like this. And he said, well, I'll come home if you buy me some medical marijuana. And we didn't want to buy him any marijuana. We'd never done that before, but we really, really, really thought he would be better off bringing him home. So we went to this dispensary. And the guy there had obviously seen him before. And he was, obviously aghast that my son was psychotic and mental. And he said, well, I told you before that you have to be clean when you come in here. But that's all he said. And then he gave him the marijuana. Oh. So we went home, and it took about 5 hours to get there. And all the way home, he was smoking this marijuana that he had just gotten. And the next morning, he got up at 6 o'clock in the morning and put on some clothes of mine, my jacket, some kind of a funny hat, went out to visit his old teachers, and came back and started talking about codes and license plates. So he was full-blown psychotic after smoking all that medical marijuana. And I called his treatment place at Kaiser, and they 5150'd him, which in California means that you were 3 days put in a mental hospital and observed to be either a danger to yourself, to others, or can't take care of yourself. So the doctor there, previously he'd been diagnosed with bipolar disorder, the doctor there said, you really need to get your son off drugs to find out what he has, because you don't know, until he stops using drugs, and he's obsessed with drugs. So it was about, finally after 3 days we had to take him home, and he was still acting, strangely, still smoking medical marijuana. Couldn't get him to stop using drugs, couldn't really talk to him very easily. He wouldn't focus. And then one day he got up and he said, I'm going to be going to visit a friend of mine. And I remember getting up to walk the dog, coming back and finding the car was missing. Oh, I should mention that he broke his wrist in a skateboarding accident like a couple days earlier. And he had come back with his hand swollen up to twice his size. And I said, you have to go to the hospital and get a cast put on your hand and get this taken care of. And he'd say, oh, I don't trust in hospitals. I don't believe in hospitals. And I was trying to get the doctors to force him to have a cast on, because it would, his hand would be deformed for the rest of his life if he didn't get it fixed. He wouldn't drive with me to the emergency room. He wouldn't, he didn't believe the doctors were going to help him. But after a couple of days, I finally persuaded him to get a cast. So when he went out that morning to visit a friend, he had a cast on. But he took our car without our permission, because we were a little worried of a manic person driving a car. And then half an hour later, the police came up to our house, and they said, we found your car. We found, I think your son was driving your car. He was driving like 100 miles an hour in a 35 mile an hour zone. And then he, got out of the car and ran away. And we have a warrant out for your son's arrest. And so, I was like, oh my God, he has to come in and take care of this, because otherwise he'll be a fugitive from justice. Mm-hmm. And I didn't know how to get in touch with him, and I called one of his friends. So he found him, and he said he was in the Cuts, which is up in the hills, in Northern California outside our town. So he had gone through the backyard of this town, very wealthy town called Atherton, and he had been running through the backyard. The jacket got caught in the fence, he lost his ID, and he ran away from the police, and he was, holed up in this fields, up in the hills. And so I, got him to come talk to me, and he agreed to turn himself in. But he had to smoke some medical marijuana before he turned himself in. And I found out that he had this marijuana on the seat in the car when he abandoned the car. And so they charged him with at that time it was a $100 ticket. That's all you had, with the possession. And then they charged him with evading the police and driving over the speed limit, more than 30 miles over the speed limit. So, it's a very long story, but when we turned him in, he was high on marijuana, and he was, sort of, I don't know how you would say it. He was acting very cocky toward the police, like, oh, you're gay because you're trying to touch me and stuff like that. But then he said, well, Mom, you shouldn't have had me turn myself in because I have a private jet waiting to take me out of the country. And, obviously had delusions. Another thing that he told me was when he was driving the car so fast, he said, I thought I was in a movie and the camera was behind my eyes. So those were some of the delusions he had when he was psychotic. And then he went into jail, and I got scared because I thought that I needed a lawyer because they put a very high bail on him because he had run away. And so I got this lawyer, and I said, he's bipolar, doesn't make any sense, so that's what you'll find when you talk to him. And he said, okay, so I'm going down to visit with him. And then he contacted me and says, your son is not mentally ill. And I said, what? You didn't see his incoherence and everything? He said, no, he's not. And so we were able to visit him on one day a week. So we went to the jail, and it was a couple days after he got put into jail, and he hadn't been able to use marijuana in jail because it was the county jail. It was very, very strict. They don't let anybody bring anything into the jail. So when we got there, he was a completely normal, different person than he had been only a couple of hours or, a couple of days earlier. He was not acting psychotic. His voice had changed back to the person that we knew. This is the person we knew before this so-called mental illness happened. And the psychiatrist had said, when I told him he had been put into jail, don't let him out, he's out of control. And so that's where, you hear about all these people that think that substance abuse is a health issue, not a criminal justice issue. But the problem is that the health community, the psychiatrists, they can't handle out of control, substance abusing, mentally ill people. And so you have to bring criminal justice or public safety into the mix. The behavior is out of control. The executive functioning is not working. The impulse control is not working. And that's what you have to deal with if you're a parent and you have these kids, and they, as a parent, you can't control them. And even the police have a hard time controlling them. So that's what we have to deal with. And so people that say that marijuana addiction is not a very serious addiction, they don't understand how it affects these very young kids, especially how it continues after they get to be 18. And then they think that, it's okay for adults to use. Well, if they're already addicted, it's not okay for them to use when they get to be adults. And then the addiction can lead into other things like psychosis. I mean, I didn't even mention the car accident that he got into. I didn't mention, all the drugs he was selling because he didn't have enough money to buy the drugs, which would continue even if it's legalized. So there are many, many, aspects of it that people simply don't understand when they think that just because you don't die from an overdose, you don't have all these repercussions. And then the public safety, when people are running around psychotic and manic, they are not caring about the public safety of their parents and the other people in the community. So it's a hazard to have this happening not only to the person but also to the rest of the community. So I just want to say that people should not minimize marijuana addiction. My son, got better from his psychosis, but he continued to use drugs, and he went through cycles. He went through cycles where he'd do okay. So after that, he did okay for like 6 or 8 months. Then he went back into addiction. Then he got into rehab, did okay for a little bit. And so it took like 3 or 4 attempts to go to rehab. Also started using heroin and injecting heroin. And he had said before he would never do that, but the one drug leads into another drug, and research has actually shown, people think that the gateway theory is debunked, but it actually shows that those people that do develop heroin addictions, many of them have had marijuana addictions before they had heroin addictions, because it's the brain is affected and it kind of primes the brain for other drugs. So the heroin addiction was really, really horrible, but the marijuana addiction was so horrible that I couldn't sleep for several years, and it just sort of, the addiction blends into the next addiction. So I'm not saying that heroin addiction is not a more horrible addiction, but what I think is that by the time you get to heroin addiction, it is stage 4. It's like stage 4 cancer. Marijuana addiction is like stage 1 and stage 2, and it can be, like stage 4 if it's really, really severe, like my son's was. But wouldn't it be better to prevent cancer or prevent addiction? And you can't have a drug addiction if you don't use drugs. So telling all these people up there, parents, you don't know what's going to happen to your kids if they start using drugs. And I think the much better situation would be to prevent any kind of disease or disorder like marijuana addiction, like cancer. This is what we want to do. We want to prevent it before it starts, not wait till it gets to be opioid addiction, because it starts with marijuana, alcohol, tobacco when they're young kids.